Hello, my name is Christine Griffin, and I'm here with Chrissy Walker to share information to families starting out parenting a child who's deaf or hard of hearing. We'd also like to thank our interpreter as well, Mary Claire Litson, who's joining us today. We acknowledge that the land and waters of the Coast Salish people and their sacrifices their ancestors made so that we can stand here today with you. We also acknowledge that their people are still present with us and thriving in current communities. We'd like to acknowledge the land that we are zooming to you from today. In Whatcom County, the Lummi and Nooksack Nation. And in Clark County, the Cladamus, Cowlitz, and the Confederated Tribes of Grand Ronde. Next slide. Today's agenda, we'll be discussing how emotions happen. We'll talk a little bit about the systems that serve our families. We'll dive a little deep into some frequently asked questions. We'll talk about communication considerations and making those informed decisions. And then we'll conclude with relationships and self-care. So first, a little bit about us. My family here on the left are my husband and our two kids. And our son was identified hard of hearing when he was 5 years old. And our daughter was identified 6 months later when she was 2 years old. To say that this was a surprise is a little bit of an understatement. It wasn't something that our family expected or our extended family. We didn't have any prior connection with the deaf community or had any other deaf hard of hearing members in our family. So the learning curve was steep. And so we had to learn a lot of information in a very fast time. We connected with other families, deaf and hard of hearing community members, professionals that worked with our family, and through our informal conversations and connections, that helped me be able to support our kids and their needs to be successful. After our daughter transitioned out of early intervention, I continued to learn all that I could as both our kids went through the public school system. Fast forward to today, our son and daughter have gone on to higher education. They work and live independently. We're pretty proud parents. They're doing great. Another hat that I wear is with the Washington Hands and Voices. I am the Guide by Your Side program coordinator, and I have a Master's of Education in Adult Learning, where I focus on parents as adult learners of children who are deaf or hard of hearing or have disabilities. So Chrissy, why don't you introduce yourself?
Yes, hello. I was born in a deaf family, and I'm a third generation member of our deaf family, and my children are the fourth. I have 3 children. The oldest son is next to me in the picture you can see, and he's typically hearing, and he's the only typically hearing member in our whole entire family. And then next our other children are deaf, and now they're using Gallaudet online college services and doing deaf studies. and the other child is not working yet, but will be potentially attending Gallaudet University. And I grew up very surrounded by deaf family members and friends. I was just immersed in the deaf world. But it wasn't until about 5 that I realized that there are other people out there that don't know sign language and that are not deaf. And because many of my neighbors already signed, and there was a little, they used gestures and they attempted with communication, and it was all just a natural, normal upbringing. But I realized, found out that our community was rather small in comparison. And now I work for CDHY. It's the Center for Deaf and Hard of Hearing Youth here in Washington State. Before that, I worked for a deaf school at Washington State, Washington School for the Deaf, for 9 years. And I focused on bilingual approach for the instruction, teaching English and sign language at the same time to appreciate and acknowledge their first language.
Thank you, Chrissy. So as you can see, each of us have different experiences, which has informed how we feel and what emotions come up for us at any given moment. This shows how families can be so unique and diverse, and the combinations are endless. Parents who just learned that the status of their child's hearing may experience feelings depending on their background, culture, how the identification experience went for their family, and any prior knowledge about the deaf or hard of hearing worlds. Families have reported feelings of relief, stress, overwhelm, confusion, love, pride, excitement, just to name a few. All feelings are common and normal to have, and it's also common for one family member to feel something different than another family member. So we wanted to share some interesting statistics. Of every 1,000 children born in the US, 2 to 3 babies are born with a detectable level of hearing loss, whether that be in one ear or both ears. More than 90% of those children are born to parents who are hearing. Some of those parents may have had no experience connecting with the deaf, hard of hearing world like our family. And so their child may be the first deaf or hard of hearing individual that they have met. Adults learn by building on existing knowledge. So because for so many of our families who don't have any prior experience in the deaf and hard of hearing world, the learning curve can be steep. It can be challenging to try to process all the information we have to at a short period of time. So information is flying at us in ways that we sometimes can't comprehend at the same rate. So the material sent to us, like for my family, kind of went unopened. I related to individuals more than reading materials. Families may just jump in and be really motivated. The one thing, no matter what you remember about this webinar, is this quote here: that parent engagement is the #1 factor in helping our kids become successful. The more that we can become involved in understanding our child's development, how they learn, their language, what they like, what they don't like, can help us help them become successful. So we hope this information with you, sharing with you today, will help you get started on your journey. So a guy named Eddie. This is just a picture of some guy, but we're going to call him Eddie. Sometimes families tell us some guy named Eddie keeps calling us. Well, welcome to the world of acronyms. Eddie actually stands for Early Hearing Loss Detection, Diagnosis, and Intervention in Washington State. This is a program in the Department of Health, and it's a system of care that supports families traveling from the detection, diagnosis, and into intervention. So from screeners to audiologists to early intervention providers, there are many people working behind the scenes to support your family. And we've been doing that since the year 2000. So some brief history that might also give you a great foundation of understanding. This work began in 1969 when an audiologist used to try to sneak into newborn nurseries in the hospitals. And she would do hearing screenings with the infants. Her name was Marion Downs, and in the top picture that's in black and white, she is the one working with the mother and the child sitting on her lap. She had a theory, Marion Downs had a theory that the earlier a child's hearing status was identified, the earlier the child can have access to communication and language. Back in 1969, it was fairly typical that a child was identified deaf or hard of hearing as they were a toddler or even as they entered into school. As we know, language development begins and there's the time in which language development happens in our children are between the ages of birth to 5 years old. So fast forward a little bit to 1994, when a researcher and audiologist, Christine Yoshinaga Atano, published research that supported Marion Downs' theory. Yes, the earlier a child is identified and enrolled into early intervention, the earlier the child can have access to communication and language development. This was groundbreaking for all of us in the United States at that time. Systems were developed, supports were built, and families were able to start getting their child screened at birth around the year 2000. In Washington State, we began providing newborn hearing screening for infants in the year 2000. That rule, there's a standard practice called the 1-3-6 rule. Once a baby is born, they should be screened by 1 month of age, identified by 3 months of age, and enrolled into early intervention by 6 months of age. This last picture on the screen is our Eddie team, Marcy, Julie, and Karen. So our community represents our children and our families here in the center of this image. It also represents deaf and hard of hearing adults, deaf and hard of hearing specialists, providers, administrators, teachers of the deaf, general ed teachers, and so on. From the start, families and their child can benefit from a network of supports that understands our kids that see our strengths and help us keep high expectations for our kids. Shown here on this image, the community offers a circle of support for your child and family. And depending on how you want to connect and other factors like access or timing, connections are more helpful during certain times of your journey.
So this next slide it lists who you can contact. Obviously, that's what it says. In the state level, the deaf and hard of hearing specific locations are like the EDDY project that Christine just mentioned, the Center for the Deaf and Hard of Hearing Youth. That's where I work. Also, the Office of the Deaf and Hard of Hearing. That's a regional deaf center that is located in Olympia. Then the Washington Deaf Blind Project is another resource, as well as Washington Hands and Voices. And under the Deaf Blind Project, they have the School for the Blind, as well as the Washington Sensory Disability Services. Hands and Voices, they also have the Guide by Your Side program that they specialize in, and those are all state level. Regarding local level contacts, the early intervention programs in schools that are listed here on the slide, you could use with a family resource coordinator. You can have this group called Family Conversations. Also, there's the Northwest School for the Deaf and Hard of Hearing. That's based in Shoreline. We have the Hearing, Speech, and Deaf Center. They have a program there called the Parent Infant Project that houses the Rosen Preschool. Also, we have Hope School in Spokane, Washington, and Listen and Talk, which is based in Kirkland. And lastly, then, of course, your local school districts will have potential deaf and hard of hearing programs housed within them. So, of course, we want to cover frequently asked questions. For example, what are the next steps after learning your child is deaf or hard of hearing? And let me explain briefly some ideas and different resources and helpful items for you. For children that are between the ages of birth to 3 years old, there's a form here you can see online that's called the CARE Plan, and it explains the process of going through this journey. The first thing we suggest is that you contact your Family Resources Coordinator, which is abbreviated FRC, and these people are involved with all sorts of leads and different systems for you to access. You could contact the Deaf and Hard of Hearing Hearing Loss Center. You can also contact your audiologist. A pediatric audiologist is advisable, and get the general information that you can receive from the FRC. But it doesn't mean you have to wait until they contact you. Of course, they're in the loop, but it would be certainly acceptable to start your journey and your process on your time. And the earlier, the better, of course, is a wise move. Any kind of hearing levels are acceptable. It doesn't require it be profound or whatever. It's just the services that you're needed from mild to moderate to severe. They're all encased. And follow-up appointments are very important as well. Like, say you want to find out more about accessible technology or hearing assisted information, those kind of things, maybe a pediatric audiologist would be a great assistance for you. And also maybe find ways to connect with other families and support programs that are out there, like example, Washington Hands and Voices and the Guide by Your Side program. Parent to Parent is another network that is out there, and there are deaf and hard of hearing programs that online you can search for and find all sorts of resources, and different agencies as well, like CDHY and different hard of hearing agencies throughout the area. And assessments are a good tool as well. And they offer partnerships and families to be able to go to fun events all throughout Washington State. There's nights that you can get together and network with each other. And if you want to consider maybe genetic testing to see if in the past the family factors, you want to learn some more about the genetics, you can go for counseling on those factors. And a genetic counselor would be the one to help you with those types of questions in whichever process that you wish to follow through. And if you haven't received the book, a family book that is a great resource, it has all sorts of information and names and resources and contact information, plenty to read and plenty about intervention and help. And notice on the bottom of the slide, there's a couple of links there. There's the guide by your side, as well as the care plan form that you can download.
So once a child is identified after the age of 3, it may appear that there are limited resources. Once a child is 3 and older, they are not able to access early intervention. So, so it can be helpful for the families to contact the local school district or their local school and contact the principal and request what's called a child find. This request starts the eligibility process to potentially receive special education services. Families can also contact the Center for Deaf and Hard of Hearing Youth, as we've mentioned, and Washington Hands and Voices through the Guide by Your Side program. We can connect with a parent guide who can help you navigate and find resources in your local area. To learn more about any of these resources, we will have a new website with a new page called Start Here, and everything is clickable and you can access all of these resources on that page. So, where can families find other families? This is a question that we get asked a lot. Generally speaking, there are many ways families can meet. Families can connect at the, every year there's a deaf hard of hearing camp for families called the Deaf Family Camp. And that is in Ellensburg, Washington, usually around the first weekend in May. And then there's also the Deaf Fiesta, also in Ellensburg, that is usually around April. And that is an event designed specifically for Latino and Hispanic Spanish-speaking families and their kids. There's also some online, there's also local deaf hard of hearing programs within school districts. So if there's, you can call your school district and ask if there's a deaf hard of hearing program or where the closest deaf hard of hearing program is. You can contact that school and ask what events are happening so that you may be able to reach and connect with other families. There are some online offerings as well. Social media is real popular. If you're a family that uses that, Washington Hands and Voices has an open Facebook page. Anyone can join or follow. We also have a confidential Facebook parent support group that parents can request to join. And we also have Twitter and Instagram. Hands and Voices headquarters, so we do have a headquarters, also offers some Facebook groups. One is called Fostering Joy for families of deaf and hard of hearing children. There's also a group for families of children who are deaf plus, have deaf plus additional disabilities. And there's also one for families whose child has a unilateral hearing loss, so in one ear. Parent guides can also connect with families and find other families within our database who might want to share and who have similar experiences. We hope that following COVID, we can get back to in-person events. We're hoping that sooner than later. So definitely keep an eye out on events depending on where we are in COVID. And then just a note for kids and children who may be the only one in their family, in their community, or in their school who's deaf and hard of hearing. It is so important for those kids, for our kids to be able to connect with other kids who are deaf or hard of hearing, and for adults who are deaf or hard of hearing, to be able to see that other people use hearing technology or use signing as a way of communicating. This makes them feel they're not alone in a very big hearing world, and it can help support their social emotional learning as well.
And so another question comes up, how do families meet deaf and hard of hearing adults? Well, really, to be able to network with deaf adults, it really has an extreme impact on the self-esteem of the child and has a positive identification with deaf adults and to realize they're not alone. Families can benefit as well by going to maybe formal programs to meet deaf and hard of hearing adults one-on-one and communicate with them, ask questions, or having opportunities to ask them different questions, or maybe see them with their technology and how they use their cochlear implant or their hearing aids or whatever access they utilize. And today we've got two different formal types of programs in Washington State to be able to meet deaf and hard of hearing adults. One is at the Center for the Deaf and Hard of Hearing Youth, and the other is through myself. I work with the Family Birth to Three program, where I teach families about language and communication and sign language and the history of deaf culture and all sorts of different information to pass on to these new families. The deaf mentors can be through the Office of the Deaf and Hard of Hearing. We abbreviate that ODHH. And if a family wants to learn to be exposed to more visual communications, there's lots of people with experience that can share their family experiences and make connections with deaf and hard of hearing adults out in the community. And the purpose is maybe to come to meet their son or their daughter and have a conversation with them. Like Christine had mentioned, what you do, you go out, you go to events, you go to these programs, and there'll be deaf and hard of hearing people there that you can be exposing your children to and realizing that there are deaf adult role models to be had. Sometimes if you go, there's a possibility there might be a panel discussion, and that would be a led discussion with different deaf and hard of hearing members talking about their history and their growing up experiences. Resources also may be through Hands and Voices. They have scheduled events. And at Gallaudet University, they have different local calendar events. There's something called the Clerk Center. It's a very good resource to connect with. Here, this quote is so important, written by Stephanie Olson. It will take all of us, parents, deaf and hard of hearing professionals, role models, mentors, guides, to increase the outcomes of the kids we serve. It begins and ends with families, but there's so much that we can do in the middle to support the parents and help them to raise confident, healthy, and happy kids. And at the bottom there, you see that the experience of a deaf and hard of hearing adults of the family's journeys, that on this little video, it's a really great little snippet you can watch.
Great. So this leads us to communication considerations and making informed decisions. As we've mentioned, each family is very unique. We have different learning styles, backgrounds, cultures, and needs. Soon after your child's hearing level is identified, there may be professionals that start asking you about communication and how, what you envision for your child and how to help them communicate. So this exploration, though, is a process and it's a very personal to each family. And only you can determine what works for your family. Um, but there is help. There are people that can help you decide what information will work for your family and what is not going to work for your family. And this information that you kind of go through and learn about is how you make informed decisions. At Hands and Voices, our motto is what works for the child makes the choice right. So there's two prongs to that. One, it's important to make sure that whatever communication you and your child are using, that your child is making adequate, appropriate language and communication development increases in their development. And then also, if a family has any questions, no matter how they use communication in their home, Watching the Hands of Voices can be a resource and share information and help families navigate next steps.
Implicit bias is something that's very prevalent. It's an attitude and belief that occurs, it's outside of our actual conscious awareness. And the control of implicit biases is important. We're not even sometimes aware that these beliefs exist. For example, sometimes maybe you're in a situation that you're faced with and you have some prior knowledge of learning that prepares you a bit for this situation that maybe can change your beliefs. And then implicit bias can also affect it. It could be implicit or explicit. It depends on your attitudes, your beliefs, and your knowledge. You need to be in control and be aware is the point. An example would be, say, for example, positive. It could be a negative bias, but it's based on choices and beliefs and what you decide. Maybe, for example, you're going to buy something. You decide based on your prior knowledge and you're making a choice about something. An example would be like, maybe I like a Honda car. Those are the good cars. That's my belief and my prior experience with. And I like how they run. It helps me with my commute. It's all great. And I'm set. It's kind of an implicit bias toward, but maybe I have a neighbor or a different person that has had a different car and their experience is different and they believe something totally separate. So it's not about wrong or right. Be aware that it's just something that you need to be aware of, and don't let it have an insidious factor in your decision making. In regards to informed decision-making, communication is really, it's the foundation for relationships and connections with other people. There's so many different approaches to communication. Monitoring your child's language development is very important, is key to their development. And adjustments and changes that might be need to be made in their language development is perfectly acceptable. If you talk about different types of communication choices, it can be really tough to make a decision or not. It's very complex and multi-layered. So, for example, my family uses ASL as a communication style, and it works great for us. Maybe another family might consider communicating in a different fashion. So we support all, and we're neutral in that effect. Some families maybe need to change their communication approach to find some more success and use more English language, or developing the different stages of communication for their child. It's a different process for children. Be aware that deaf and hard of hearing children develop in their language much differently than their typically hearing peers. Articulation and language development are really, they're separate things altogether. Utilizing language development and watching your children as they grow is very important, because we know that the window for linguistic acquisition is from birth to age 5. And the longer we wait to diagnose, then the smaller that window becomes. So it's best to teach them everything possible, because they're sponges at that age. And they really just take in everything you can give them. As much as possible, purposeful communication before that window closes at around age 5. And in regards to communication, sometimes it can lead to different self-esteem things and identification, and maybe using ASL. They could copy the way you sign, or maybe we realize there's not just one fit for all. That's not the way we believe. We know that what's best for the child is the best choice altogether. But the point is, don't wait and allow the child to make the decision, because you're the parent and we're the professional people to help give them that communication capability before that window closes. If they're not identified till later, then they've missed out on a wonderful opportunity, an important language opportunity for acquisition and development later. So for some families, maybe their style and their decision would change over time. They realize something is not fitting, or they discover something that would be best and helps with the development of the child in a positive way.
All right. So the Center for Disease Control, CDC, has some great materials. Parents report that they're not quite sure what questions to ask. So families and professionals got together and they put together this list of questions to ask our child's genetics team, medical professional, early intervention provider, ear, nose, throat doctor, audiologist, and speech and language pathologist. There's specific questions to your child's deaf and hard of hearing needs. 2 other resources at the top here, shown here, is the Decision Guide for Communication Choices. It's actually a process, and it helps the families go through this process and to explore those implicit biases, as Chrissy explained. And then the other one here is Making a Plan for Your Child. And that's a good resource for when your child is entering into early intervention and working with your early intervention providers. There's a lot more at this link that you can explore. And again, it's also will be on our website.
And now we'd like to discuss the relationships and self-care that are so critical. We hear from the veteran families from days gone by when they think back when they first started, they wish they had more time to really just focus on the quality of life instead of being so busy and overwhelmed with learning something new. To start something and have some support, some fun with the child, maybe, just disconnect from all the stuff and have an important time just to focus on their child, slow down, enjoy each other, have some social time and have different activities. And it is very important for the children's development as well. You want to follow their lead, what they're interested in. Sometimes everybody gets a little overwhelmed, and allow them to have some quiet time and to kind of tune out. And other times people are talking about sibling time, being able to share with their brothers and sisters, just play and be free to really have a child life, so to speak, as well as you. Celebrate with your children and have some fun and some wonderful times. It builds a bond, it builds a trust that is so integral to the child's growth and the relationship with you and the bond with their brothers and sisters as well as them.
All right. So as I promised, we were going to talk a little bit about fostering joy, and the Facebook group Fostering Joy for Families of Children Who Are Deaf or Hard of Hearing is monitored by the Hands and Voices headquarter group. The Fostering Joy is a family and professional collaboration in celebrating the joy of raising our children who are deaf or hard of hearing. For each child, loving and supportive families provide a strong base for social and emotional health and well-being, focusing on special moments that bring us joy. Helps our families to, as we said, celebrate, put aside those concerns for the moment, and make those connections with our kids. Those are really, really important. In these ways, our children will know that they matter. They'll know that they are deserving of connection and all good things. And so with that, we wanted to just share that we want you to celebrate your child, that we know that this starting out can be challenging for some of us, but there is hope and there is joy. So in summary, we've talked about how families are so unique, how we have different reactions and emotions to the news of that we find out our child is deaf or hard of hearing. These emotions come and go. And we learned a little bit about our state EDI system and the network of care and support that surrounds our families. We've learned a little bit about what it takes to make informed decisions when it comes to communication or anything else in that regard. And then, of course, celebrating our kids and celebrating our families. So we hope that we have answered some of your questions and started you on your journey. Again, we want to thank you for your time today. If you have questions and want to reach out to either Chrissy or I, here are our email addresses that will get you started connecting with us. I should also say that we talked about the Center for Deaf and Hard of Hearing Youth. And so Chrissy's address says CDHL. You can get her with this email address, or if you want to put CDHY. in the email address. That will also work. Thank you.
Thank you very much.